The Applebaum Simulation Learning Institute at Beaumont Hospital is one of the most advanced medical training facilities in North America. Its mission is to provide world-class leadership in education using state-of-the-art technologies to improve skills for all healthcare providers in a safe environment.
The function of the center is to serve as a site for experiential learning for a whole variety of learners, from physicians, residents, medical students, nurses, and various paraprofessionals.
We use the Surgical Learning Center to teach surgeons from all over the country and all over the world how to perform minimally invasive procedures.
The technology that we have in here is just amazing. The simulators, like for instance our endoscopic simulator, where you can practice EGDs, bronchoscopy, colonoscopy, it is just so lifelike.
It basically models what hospital life is like in one place.
Here at the Stimulation Learning Institute, we do have all of the resources that would be available in an OR or at a bedside. We really bring as much as we can here so that it feels as real as possible.
With 3 full-size modern mock operating rooms and a large bioskills area with oversized tables, the Institute accommodates most any type of program, from a large conference to intimate one-on-one learning.
In our BioSkills lab, we have custom tables that have been designed for our many uses. The countertop that we have is nearly indestructible. When we do pull back the countertop, what it reveals is the downdraft capability for doing a variety of different fixed specimens. There isn't another table like this in the country. It was a custom design so that we have all of the capability that we need to serve all of the customers that we have.
One of the core parts of our mission within the center is research, and we have been involved in research from the beginning.
And some of that research has led to new techniques that surgeons are now teaching to physicians from around the globe.
We've done 3 seminars now, which are CME events, for continuing medical education, to train physicians on how to do neuromodulation. We've been fortunate that we've had good physicians from across the country come and visit us, and then they start doing it in their own community.
Every year we host the Minimally Invasive Neurosurgical Society. We use the Belmont Surgical Learning Center as a cadaveric learning facility. Last year we had participants from as far away as Taiwan, Australia, South America, Central America.
When they come in and they practice and they learn here, they're learning on what they'll be using in the real OR. We have booms, we have equipment, we have the operating tables, we have all of the instrumentation, we have surgeon-specific trays. Anything that might be used in the operating room, we can have here. We have an EC exam room, an EC trauma room, a patient care room, and an additional debriefing space in that area as well.
Simulated learning is not only for physicians to refine and gain new skills, but this facility also attracts nurses, residents, and medical students.
The Institute at Beaumont allows me to safely practice procedures before actually doing them on a real live patient, so I feel confident, comfortable, and able to perform procedures safely.
I taught them how to do suturing and knot tying skills here. We did chest tubes, we did central lines, and then we used the ORs and the simulation aspect of it to do simulated trauma patients and simulated surgical patients so they can practice clinical decision making on their own. We also have colonoscopy simulators and things like that. So we try to incorporate that into the general surgery skills curriculum.
Other great ones are our Trauma Man simulator. That one, it just feels lifelike. You can actually listen to the heart and the lungs, do a physical exam, check the pulse. The monitors can show different types of physiologic situations that actually really mimic real life. This would be a great avenue, I think, for other people to bring in new techniques, new procedures, new equipment, for everyone to use in this calm, safe environment.
Vendors who have something that, an idea that they want to do, a new technique that they're looking to teach, it's easy to see that this is the ideal venue for that. It's the ideal venue for programs because of the physical space that we have, the personnel that we have, and the expertise of the people that help to bring these ideas to fruition.
So those physicians and those surgeons can really come here and practice the skill here in the facility where we have the opportunity to use OR tables that they might use in the OR, learn new techniques, practice with new products, work with vendors, etc., all in one centralized location.
We've had cadaver training sessions in hotels, and it just doesn't work. You don't have the lighting, you don't have the visualization.
Our mission is to make sure that our patients have the best outcomes. And so we will work to support every possible learner that comes through our doors, whether it is a seasoned surgeon or a new medical student that is just entering the field.
I've had the opportunity to visit many other teaching centers across the country, and I truly believe this is one of the best, if not the best, in the nation.